slide. Okay, let's talk about anxiety. Um, so, anxiety is a very interesting dilemma because it's a human experience, right? It's a very familiar thing. And also, just to know, if you look at all of the humans on the planet, there's about 20% of them that have an anxious temperament that is a normal, kind of temperament. But it's someone who's a little less, kind of bold, someone who's a little more of an introvert, a little more prone to not being the first one in the sandbox, the first one in the deep end, people who hang back a little bit. And it's a wonderful trait. It's a magnificent trait, but they are at risk to develop anxiety disorders. So you have to kind of, if you have one of those kids, you have to kind of nudge them a little bit all the time to do stuff, or they can get themselves in trouble. And also, the amount of kids with symptoms of an anxiety disorder has kind of gone nuts. So, it used to be 7 or 8%, we thought before the pandemic, and now, and depending how you ask people, maybe up to 25% of people describe, some sort of intense sort of anxiety and worry that affects their daily life. And I think we've it adjusted with the pandemic, and we haven't adjusted back. So everybody's still complaining about the same levels of anxiety that they talked about during the pandemic. And so the amount of school refusal, the amount of kids going to the pediatrician with somatic symptoms, all those things that you get with anxiety have, kind of notched up and stayed up. So we're struggling. And I think in some ways we have adjusted and changed our expectations and changed the parent-child relationship and all that kind of stuff in a way that we're having a hard time changing back. So it's an interesting problem. These are the big areas that come up. I'm not going to read through all this, but kids will present with different versions of anxiety. Um, and one of the hardest ones is that the cognitive stuff, the catastrophic thinking and rumination and a clear underestimation of their ability to cope. So, humans are very resilient animals, right? So we can live in the Arctic, we can live at the equator, we can live in all these different settings, and so we can really cope with a lot of stuff. And people say, well, I can't go to school if there's a quiz today. It's like, well, that is not true at all. The idea that people underestimate their ability to cope with stressors is haunting us, I think, and it's a hard one to do without seeming like a badass sort of person. If you say, oh, well, that's silly, you just go ahead. Everybody looks at you like you're some sort of meanie. What happened to all the grace and all that kind of stuff? And I think again, that can be overdone. It's a nice idea, but it's not necessary for most people. There are some screening tools. The Scared is the one that I use all the time for kids and teens. And there's a parent report and a self-report. It's got 41 questions, but it screens for all different kinds of anxiety, which is the GAD-7 only does for generalized anxiety. There's some others, and but I think if you find any and you stick with it, you become familiar with it. I use these for baseline and for follow progress over time. Because it's anxiety is kind of amorphous, so I like to have some sort of tool that I use to measure the severity. This is what the scared looks like, um, and this is the other side. And then you add up the score, and there's and it helps you follow what's going on. And it really captures a lot of those different kinds of flavors of anxiety, and because it can be so variable from child to child. So, all right, so what do you do? Well, here's my philosophy: exposure, exposure, exposure. I mean, this is something we've known for a long time. Edna Foa is a child psychiatrist, she was in Baltimore. It's Johns Hopkins for a long time. And basically she said, listen, you can treat anxiety in a lot of different ways, but if you expose people to the things that make them uncomfortable for a sustained exposure, that anxiety goes down. And that is the basic mechanism of managing anxiety. It is not the one that people want, right? It's not the easy one. So you can teach people coping skills, different strategies to manage the anxiety. You can you can do step by step. reentry plans, like for kids out of school. You can use SSRIs maybe to take the edge off that. But basically, sustained exposure requires raising expectations and holding kids to that, and being their cheerleader. Coaching them on, encouraging them. But avoidance is a trap. Kids will want to not do stuff. They'll want to stay home. They'll want to avoid this and that. And the more avoidant that you are, um, then you become sicker, right? And that came up in one of the groups. And so, it's a natural thing to do. And I'll talk a little bit about why that goes south, right? Why this philosophy, I'm telling you, this philosophy is extremely difficult to sell. And I've done a lot of work trying to, have meetings with families around this, and even some teachers and some primary care doctors who, have a hard time with the idea that you have to suffer a little bit to get stronger. And that whole philosophy it's not a universal one, but it's one that really applies to anxiety a ton. So if you're thinking about one of our jobs as educators, right, is to get people ready for young adulthood, right? And so, in order to manage these things on top, how do you handle your time? How do you interact with a whole bunch of different kids and adults? And how do you handle academics, to the point where you're ready for young adulthood? Well, your best chance is if you go to all your classes all day and do extracurricular activities. And then your smallest chance is if you're sitting home on home instruction. And then you're not managing any of these things, and so you're not really getting ready. And these are the things I call them the ladder skills. This is what kids need to be successful adults, and our job is to help them through their life to build these things. And these are a high priority, maybe even a higher priority than the content of what we teach kids. That they need to be able to try hard and to have stamina and resilience and be adaptable and kind of make independent decisions. All those things that are going to help them as a young adult. That their childhood and adolescence is the prep for that, right? That's what we're trying to do. So this is really important. I don't know how many times I've shown this to families. Would say, the last time anyone will help you with your child to develop these skills is while they're in school. And as soon as they graduate from school, you are on your own. You have to help them develop all these things. And it's not easy. There's a pretty high failure to launch rate. And, to try to avoid that, you want to work at this all the time. So, all right. So why does it go wrong? Well, exposure is not the natural response to a child's distress. So if you have a child and you see a child in distress, you want to decrease their distress, right? That's a natural reaction. So perfectly fine as long as all you have is an acute stressor in a normal situation, right? So your child is, they're riding in their car seat and suddenly they go, "Eh," and they freak out and you like, what's wrong? What's wrong? And you stop and you pull over and you fix it, right? So the natural reactions to a child in distress is to make an accommodation of some kind until the distress goes down. And that's fine unless you have a chronic anxiety problem or extremely anxious temperament. Then it's not so fine because then you have to say, okay, I can't do that. I have to let them. So when you say tomorrow is a school day, we have to go to school tomorrow, and they go like, I don't want to, I don't want to go to bed. I don't want to get up. It's terrible. I hate school. My teacher's mean. The kids are mean. I don't like the food. It smells bad. There's a million things on that merry-go-round of things that reasons that kids don't want to go. And the parents just have to say, well, you can't give in to that, right? You have to say, oh, it'll be fine. And you like school and and your teacher's waiting to see you and all that kind of stuff. All the stuff you do as a parent, to say it's not dangerous, and I'm not going to accept you seeing it as dangerous without giving a little pushback. So and so the other problem, of course, anxiety runs in families. That came up in some of the groups. And that's very important. And I think Melissa's going to talk to you guys about the SPACE program, which is a great program to teach parents how to parent kids on that anxious temperament and anxiety disorder world, because there's some strategies that are very effective and others that are a trap. Um, and so the other thing is we tend to not have one of the ways you work with anxious kids and parents is to have really refined empathy skills. And so you can pick up on what's bothering them right away. And you don't have to give in to what's bothering them just because you understand it and can put it into words. So you can help them express what's going on. You can help parents express how they're feeling about things, and then you that gives you a place to push off from. And so it's not like because I have empathy I have to yield to your distress. No, because I have empathy I can tell you I understand what you're saying, and you still have to get on the school bus. I hear you, what you're saying this and all these things. But I think the school bus is safe. I'm your parent, you need to go. Have a good day, see you. And um, empathy skills are help you stay oriented and connected to a person. It doesn't mean that you have to be driven by them in certain behaviors. I think schools need to identify and develop safe people. I have several families that one of the things that finally helped them get their child to school was there was someone at the school they trusted. And so when Junior comes home and said, "My math teacher swore at me today, and I don't want to go back tomorrow," before the parent reacted, they would call that safe person and say, "This is what Junior said. They said this happened. Could you look into that?" And the idea is that you're going to go to school every day. If there's a problem, we're going to solve the problem. But staying home is not the solution. But in order to feel that way, parents need to know there's a person they can call who's going to check into this and give them the lowdown. And that's really powerful. And so sometimes it's a principal, sometimes it's a vice principal, sometimes it's a counselor, sometimes it's a teacher. It can be a variety of different people. Some people are better at this than others, and that's fine. But I think if you have a school that you need to have those people, and they need to step up when there's a family who's reluctant to send their kids to school or who's having a hard time, kind of dealing with the anxiety related to being in school. Now, the other thing is school administrators, I think it's important to understand how anxiety ecosystems work, and the fact that we're playing the long game and not the short game. So, if the goal is to say we're not going to have any disruptions in the hallway this week, then we're in trouble because then we can't nudge kids. So, if the idea is that we're going to try to get all the kids to attend school and perform at their best. And sometimes they get upset, and that's okay. We can handle that. That's much better. So, and I talk about the short game and the long game all the time with schools and with families. That the idea is that we're playing the long game. We're trying to get your child ready for young adulthood. And so there might be some bumps in the road. I don't care. They should have bumps when they're kids and not have bumps when they're in their 30s, right? This is when they should learn how to deal with bullies, and this is where they should learn how to deal with teachers they don't especially like, or this is when they should learn to do work that's hard for them. That's okay. They're going to need that skill, so that's what we're going to try to do. So those are all things that make a huge difference. But basically, I think managing anxiety comes down to circling all the wagons, right? So the outside circle here is all the different agencies that are involved with kids, and I apologize if I didn't mention your agency, because there are a lot of them, right? And then you have the core, which is their primary care, their school, and basically their family, maybe mental health providers, and the child and family are in the middle of all this. The other thing that I think it becomes very important is that we communicate with each other and we let the families know that we have a teamwork approach. So we're gonna know who your pediatrician is. We're gonna know who your community counselor is. We're gonna know what agencies are involved. And so that's going to be kind of normal to communicate with each other. And we're not going to communicate through the family and put that extra stress on them by saying, the school saying, tell the doctor to do this, or the doctor saying, tell the school to do this. It's like, no, the doctor and the school can talk to each other. We just need the right releases. And that because that's that's stressful for schools. I mean, for families, they cannot get all the messages correct, and then they get caught in between, and that's another source of stress because we don't collaborate as well as we could. So these are all efforts I think that can make a pretty big difference to this like whole child approach. So everybody is on the same team, and it's there's nothing worse. Yesterday, I got a call from a fellow that I work with, and she's like, the therapist is asking for a note for the child not to go to school, and the school thinks that's a great idea. And I'm like, oh no, we got 0 for 2. What are we going to do here? I said, well, luckily they can't get a note from you without you writing it. So let's just, how are we going to respond back to them to say thank you for your efforts? And I know you care about kids, but I think, this child needs to attend school. We need to do more for the child in school, um, and not if they are in home instruction. I think it's going to make things worse. So, this happens every day. I get these kind of calls every day. All right. And these are some of the references, including the CAM study is a big study. I mean, there is some evidence that if you have a lot of anxiety and it's impairing, that you can use medicine. It helps a little bit. And I think the cognitive behavioral therapy also helps a little bit. They both do about 30–40% of people get into remission. The combination is better, but trying to get people to go to their pediatrician, get on a medicine, take it every day, go to therapy, do CBT, learn those skills, trying to get that to actually happen is a battle. And I know you guys all know that like this in theory, this is great. Dr. Walk up here and say he does this study and he finds out that you know, like 80% of kids who get good CBT and a high dose of an SSRI are in remission. You say, yeah, Dr. Walk up, but come over to Yates County and see if you can make this happen. It's not so easy. But so a lot of that's going to fall on the schools and on primary care doctors, and on everybody keeping this philosophy of exposure being highly valued. There's a Coping Cap program, which is a manualized CBT program that's pretty cool. There's some websites, Anxiety Canada and Mind Masters program. There's a bunch of different ways, especially when people cannot get to good therapy. There are ways to do some of that work online. And so I think I'll stop and ask for any questions. And I don't know if Melissa, you want to jump in here a little bit?
Oops. Well, I think the only other thing I would add is just a plug for a really innovative program called the SPACE program, and I alluded to mentioning this. And Jim's comment at the beginning of our conversation around the parent being a big factor in supporting anxiety and thinking about accommodation is really true. And SPACE is a parent-only intervention that was designed to help parents do two things. One, increase support, but it's not just reassurance. It's validation with confidence that you can do a hard thing while also decreasing the accommodations that they're offering in the home. For example, if a kid can't go to a different room to get their backpack, how do you decrease the likelihood of the parent accompanying them? That's an example of an accommodation. So how do you increase support and decrease accommodation? And the space therapists work very closely with parents to learn how to do that and then chart where are they accommodating a kid and how do we start to break that cycle of accommodation in a very concrete way with plans, and how do we tell the kid that we're doing this, and how do we then actually implement it, along with how do you deal with some of the challenges that come up, like aggression and self-harm and recruiting supporters and dealing with, like, if your co-parent maybe isn't on board. And the space program, you can find providers by zip code, spacetreatment.net. Many providers will work via telehealth. It's a nice telehealth-based intervention because you're working with parents directly. We do offer space at URMC, and Linda, I don't know if you want to talk at all about how that works.
Yeah, people that are interested, parents that are interested in space, complete a phone screen, and then what we call a caregiver screen to see if any of our caregiver programs, including SPACE, are appropriate for the child. We do see the child during one of the caregiver screen with the parent to make sure an appropriate intervention for the level of impairment. And then after that, the parent works with the therapist individually. Oftentimes, one parent will join, sometimes both parents will join, or both caregivers. Um, Sometimes it's a parent and a grandparent, or two grandparents, or an aunt and uncle, whoever the primary caregivers of the child. And it's been well received by
Yeah.
parents.
Um, and I also want to just emphasize that there are other providers also that you can find on spacetreatment.net. Many will do telehealth. You need someone licensed in New York to work with New York State students. So it's a really nice parent program. We also have a really